As part of your initial delivery, you were provided with tubing, nasal cannulas or mask, connectors, and 2 tubing adapters, sometimes called Christmas trees. Your cannula needs to be replaced every 2 weeks, and the tubing needs to be replaced every 90 days. If you discover that moisture has gathered in your tubing, refer to the patient instruction booklet for further information. If your physician ordered a humidifier, fill using only distilled water. This will extend the life of the humidifier and reduce the likelihood of bacteria buildup that could lead to illness or infection. If distilled water is not available, ask your physician if boiling tap water for 20 minutes is acceptable. Allow the water to cool before filling the humidifier. When refilling, do not overfill and use care when replacing the top to avoid cross-threading the cap. It is very important to clean your humidifier bottle every 3 days. Please adhere to the cleaning and disinfecting procedure for humidifier bottles outlined in the patient instruction booklet. Your technician has all of these supplies on the vehicle and can provide them to you as necessary. If you need additional supplies, please contact your local Apria branch or let your delivery technician know at the time of your next delivery. There are numerous safety precautions that you must follow while using oxygen. Oxygen equipment and tubing must be kept at least 5 feet away from heat sources and flammable materials such as oils, grease, aerosols, paints, gasoline, and solvents at all times. Never use oil-based creams or lotions, a hair dryer, electric razor, or other small electric appliances while using oxygen or carrying oxygen equipment. You should also remain at least 5 feet away from open flames at all times. As necessary, you should clean the exterior of your oxygen equipment with a clean, damp cloth. Never use wax or cleaning sprays because many of them are flammable. When using oxygen, it's best to cook using a microwave oven. Cooking on a gas or electric stove, a barbecue, or in an oven is not recommended. Remember, there should be no smoking around oxygen at any time. Always display the oxygen in use signs provided to you during your initial delivery prominently in the front of your home and in the room where the equipment is in use. Your front door or window is a perfect place for these. These signs are for your safety and to help emergency personnel know that oxygen is in the home. We recommend that you install smoke alarms outside each sleeping area and on each level in the home. Fire extinguishers are also recommended. To minimize the risk of tripping and falling, be careful when moving about while using oxygen. Be aware of the tubing so it does not become entangled, obstruct your movement, or pose a tripping hazard. Throw rugs should be stored elsewhere and should not be placed under or on top of oxygen equipment. Your delivery technician provided you with some basic troubleshooting tips. Please refer to the patient instruction booklet for additional information. Apria is pleased to provide you with home health care service and equipment. Our staff is dedicated to providing quality service and products and making sure that you are comfortable with using and caring for each of the devices we have talked about. Your Apria representative provided you with contact phone numbers that are answered 24 hours a day if you need to contact us with questions or equipment problems. Our website, www.apria.com, also has many topics and articles that you may find helpful. On behalf of all of the employees at Apria, our best wishes for your health and well-being.